I can't imagine what a child's last minutes alive would be, and they're innocent. They don't know what they did wrong.
It has become an all too familiar story in Canada. Indigenous children apprehended at a disturbing rate, thrown into a system seemingly designed for Indigenous families to fail.
For them to experience the trauma and the abuses that they're currently going through, that in itself is a travesty. Many call it genocide, and in essence, it is genocide.
Indigenous children now make up more than half of all kids in care across the country. It has been called a humanitarian crisis by government and genocide by First Nations. But what happens when those same children die in the system?
The amount of bullying that workers inflicted upon the biological parents was just something I never encountered in all my years of police work or working in government. It's a lawless place.
Tonight, APTN Investigates brings you the story of one mother's search for answers into the death of her infant son. She wants to know why it took over 7 years to get a copy of his autopsy report, and the reason no inquest was called into his sudden death.
I thought that they would have to. Isn't it mandatory to have a big investigation for children in care when they die? Like, everyone should have been making statements too. Like, this shouldn't have been hush-hush.
Saskatoon, Saskatchewan. In 2012, 21 children died either directly in care of the province's Ministry of Social Services or within 12 months of accessing services from their staff.
He was a good baby. He was very calm, quiet. He smiled. He had beautiful blue eyes. He was just always happy, so good. A very good baby.
This is Maria. It's not her real name. Under the law, we are not able to identify any family members of children in care in the province of Saskatchewan. Maria's son was just 17 months old when he died while in custody of Saskatchewan's Ministry of Social Services.
Scary. It's traumatizing. I get the shakes, I get nervous. Anxiety just goes right up. Like, they have so much authority and they get away with so much that I fear them.
Even before the death of her son, Maria already had a deep distrust and fear of the child welfare system. She struggled with addiction and had 3 other children apprehended. She also claims that she was pressured into signing her children up for adoption by social services.
They came to my mom's house, and there was about 3 or 4 of social workers of the government that came into my mom's porch, and they kind of circled around me and saying, I need to do this. You need to sign your children over. They're in a better place. They're going to get taken care of. They're in a good home. They're going to get provided for. What you can't, because you're not healthy.
Would you have ever thought of doing something like that had they not kind of forced you to?
Probably not. They had a lot of, I am very vulnerable. Like, I tend to follow what somebody else guides me to or thinks, like, puts into my head, makes me believe of myself. I didn't feel like I was good enough.
It was shortly after that encounter that Maria got the news that would change her life forever. Her son had been found dead at his foster home. The official cause was ruled as sudden unexpected death syndrome.
It was pretty hard. When I came to the funeral home, I saw my baby and he had a goose egg on his forehead. And me and the father were wondering, like, where is this coming from? We did ask the funeral home, but I can't remember their response to it. It just felt really, it was bad.
But that was only the beginning of what would turn into a 7-year nightmare. Maria wanted to get more information on the death of her son, more specifically a copy of his autopsy report. She reached out to government officials, social workers, child advocacy groups, and even legal aid. No one was willing to help.
I was tired of waiting. Like, there was just, why were they getting away with this? My life was together. I was keeping up with my sobriety, and I changed my life around, so I was ready. Like, I was ready to fight, and I wasn't, trapped in that addiction. And so I searched on the internet how to get an autopsy report, and it said the coroner's office.
It should be the chief coroner's duty to make sure that the biological parent gets a copy of the autopsy.
Mm-hmm.
And that was all it took. After 7 long years of being told that there was nothing anyone could do to help her, all Maria had to do was call the coroner's office and fill out an official request form. She received a copy of her son's autopsy report within days.
I was just surprised, like, how easy it was. I fought for how many years trying to get that autopsy. Even legal aid, like, I tried to go through legal aid and he can't even give me an answer. Like, child's advocate, why are they telling me there's nothing they can do? And all they had to do was provide me with information to call this coroner's office. Like, I don't understand why they were keeping that hidden from me.
But the report only left Maria with more questions than answers. Here's what we know. Maria's son apparently died in his sleep. He was found by his foster parents the next morning unresponsive with no pulse. A post-mortem was then ordered by the coroner's office of Saskatchewan. While the autopsy report noted signs of trauma on the body, including abrasions on the forehead and contusions on the right upper arm, left shin, and lower extremity, the coroner found that there was no sign of any significant trauma that played a role in the death.
Seeing that there was bruising all over his arms and legs, just remembering that he had that goose egg on his head, made me feel that there was definitely something that happened. But I was just trying to keep it together until we got to a health professional right away, before I let it get to me.
APTN Investigates wanted to help answer some of Maria's concerns regarding her son's autopsy report. With her permission, we sent a copy to Dr. Janice Uphoven. Uphoven is a pediatric forensic pathologist based out of Minnesota, who has worked hundreds of cases involving the deaths of children.
It's tragic whenever it happens, and unfortunately in young children, it's not that uncommon. Sudden deaths do occur. However, they require a very in-depth and appropriate investigation.
While Dr. Uphoven found no evidence to contradict the final conclusions within the autopsy report, she also had some unanswered questions. One had to do with the toxicology. The report says that the toxicology was negative for alcohol or any common drugs of abuse, but it doesn't say what types of drugs they tested for.
it doesn't look like they actually ran a full toxicologic analysis. And there are any number of over-the-counter or prescription drugs that could have caused the death. There's any number of possibilities that have, I don't think, been necessarily explored from just the autopsy itself.
Then there was the time of death. The autopsy report notes green skin discoloration of the abdomen, which Dr. Uphoven attributed to decomposition. According to Uphoven, there shouldn't have been that level of decomposition if the child had died within a day of the autopsy being performed.
The only real puzzling thing for me is the autopsy was performed the next day, and he was already showing decomposition. For him to start decomposing in essentially 24 hours would be really unusual.
We played part of Dr. Uphoven's findings for Maria and her spouse.
We don't know when he died. Yeah. And the green abdomen leaves me suspicious that it wasn't that morning.
Oh my God.
But then only the investigators can tell us that. But if he said he performed his autopsy, the next day, and if he didn't handle the body properly, it'd been in a locked cooler, it says, he wouldn't have gone over that fast. He just wouldn't have. So I have some questions about the time of death and the toxicologic analysis.
It's been over 8 years now since Maria's 17-month-old son died in care of Saskatchewan's Ministry of Social Services. 8 years worth of building suspicion and unanswered questions over how he died.
This is why I want my story to be told, so that it's in the public's eye, so that they can protect our children from this from happening. It's happening all the time, and they keep getting away with it, and they keep playing these games with everybody.
One way to get some of those answers is through a coroner's inquest. But those investigations aren't mandatory for children who die in care of this system.
Do you think there should have been some kind of inquest into the death of your son?
Yes. That should be mandatory for a child in the system, since how many children are dying in this country being in the system.
Tim Coral runs a small farm on the outskirts of Saskatoon. This allows him the time to focus on what he considers his true calling, advocating for children and parents caught up in Saskatchewan's child welfare system.
This is kind of the only reason I'm able to advocate, because I farm, and otherwise I wouldn't be able to afford to do it. I'd have to be working for a living. Come on.
I think what disturbs me so much in this particular case, and I've reviewed some documents and spoke to the family, is that it took the mother 7 years to obtain the autopsy report. I just think there's absolutely no excuse for that. When I think of this, there's only actually two reasons that spring to mind why someone would deny a biological mother an autopsy report. One, they're trying to cover up something, and two is it's their way of bullying the mother and continuing on with this power dynamics that occurs between social services and their clients.
It's a vicious cycle of abuse that Coral knows all too well. He experienced it firsthand from his time as a police officer in the city of Saskatoon, and more recently as Deputy Minister of Social Services in Saskatchewan.
This is regular. This is how they're treated when they access government accountability or accountability in the system. It's a struggle for them right from day one, and it continues because I mean now we have 7 years of history, and of course there's all sorts of things and anxiety and worry that's built up in this family, and now they got to start searching for answers 7 years later, and they're never going to be satisfied with the answers because there's too much time has passed.
So why did it take over 7 years to get a copy of the autopsy report? Why wasn't there a coroner's inquest called into the death at that time? Should these types of investigations be mandatory for all children who die in care of the system?
Well, you know, I can't think of anything worse than a family member who has a child die that's been taken away from them or is in care of social services or another agency. I think we're doing a very good job right now of trying to give information to those families. You know, you brought up in the past it took that length of time to get an autopsy report. It shouldn't take that long.
Clive Wayhill is the chief coroner for the province of Saskatchewan. Back in 2017, the former Saskatoon police chief was appointed to head a comprehensive review of the coroner's office. His report highlighted significant problems with how the province investigated unexpected deaths.
At that time, it was taking us about 5 or 6 months to get a toxicology, a screen result back. It was taking us over a year or so to get a pathologist report. It was taking us 18 or 2 years to get the files done. So, and I think people were sometimes reflecting upon, oh, I think the coroner service doesn't really care about us because it's taking so long. But what I found was the complaints that I had from the Indigenous community specifically were almost the same complaints I had from everybody that I interviewed.
Wayhill wasn't able to speak with us regarding specific cases. And while he couldn't comment on why there was no inquest called into the death of Maria's son, he doesn't believe they should be mandatory for every child who dies in care of the system.
I think whether or not an inquest is held depends on the circumstances. It could be a child that's in care with cognitive issues that the expectation for that poor child is not to survive. To have an inquest in that case, I don't think would be relevant. We would know the reason for the death, we would know the cause of the death, we would know who it is, and we would know the circumstances for that. So to have an inquest into that would probably bring more harm into the family just to relive that again. We're trying to call discretionary inquests a little more often now if we believe that it's in the public interest to learn of the circumstances of that death.
So is Saskatchewan's child welfare system in a state of crisis? When APTN Investigates first requested the number of children that died in care between 2008 and 2018, we were told that 38 children had died over that time period. But it turns out those numbers aren't entirely accurate. They only take into account the children who were directly in the care of the ministry at the time of their deaths, in arrangements such as foster care or group homes. APTN has since learned that in fact, 242 children have died over that same time period, all within 12 months of accessing services from the ministry.
We feel like most parents and grandparents and caregivers feel. We feel as though we're taking many, many steps back. We're not progressing to a positive, healthy future. We feel at this current year, 2020, that these numbers far outnumber the number of children that were in residential school.
Bobby Cameron is the chief of the Federation of Sovereign Indigenous Nations. He sees the challenges Indigenous families face when dealing with the child welfare system on a daily basis. His organization represents 74 First Nations across the province.
Oh no, they're being treated like dirt. Like they don't matter when these are their blood relatives that are going through this travesty, the tragedy. We had some individuals that within the last decade lost little ones. And still to this day, they have not healed because they haven't had closure. They haven't had the investigation fulfill them, a weak investigation.
Cameron says that the system is designed for Indigenous families to fail, and that without a meaningful commitment to change from all levels of government, it's only going to get worse.
We're all human beings, and our children should be our most greatest asset, the most precious gifts that we have. And for them to experience the trauma and the abuses that they're currently going through, that in itself is a travesty. Many call it genocide. And in essence, it is genocide.
APTN Investigates requested an interview with Saskatchewan's Minister of Social Services. We wanted to find out what the province is doing to address the high number of deaths on their watch. We were told that the minister was not available to speak with us.
She's not going to stop until she gets some answers. And I think in a way, she is concerned about her child dying, but the also concern is, what about the next child? What about the next mother down the road? How is she going to be treated?
Of course, any family that has a tragedy of this nature, all they want to do is, feel like they're being heard. The minute families begin to feel like they're being heard is the minute they begin to heal.
For us to be able to heal properly, we need those answers, because it's constantly on the back of my mind. Like every day we talk about it. And I think that we need answers, that we have that right. That's our right. That was my baby, and they need to give that up and stop protecting.